Orthopedic surgeons at Shelby Baptist Medical Center now are going to have some help in the OR.
It's a robotic surgery system for hip and knee replacements. The system is designed to enhance accuracy when removing bone and cartilage from a damaged joint, as well as when guiding the placement of that implant. Surgeons tell me this is good for them and for the patient.
This is actually the arm. So in the OR, once we get in there, we'll bring this in next to us just like it's one of the assistants in the OR.
Surgeons call it a second set of eyes.
What the robot does is it guides us to make sure our hand is in the correct position.
Dr. Lloyd Johnson and other orthopedic surgeons at Shelby Baptist will soon use the Mako robotic system to do hip and knee replacements. How does it feel to have that extra layer of help?
Well, so I think it's good in the sense that you've got basically another set of eyes that's verifying what you're seeing and a way to confirm it.
Johnson says although the robot is there, patients need to know the doctor is still in control.
With the robot, the surgeon is still there. When we do the surgery and we bring them to the OR, the surgeon is there. We still do the same sort of surgical approach. It's just we have another device to have us get more accurate cuts to hopefully improve the longevity of the implant.
Johnson says the robot provides specific anatomy to each patient, which enhances the surgery.
The other advantage of the robot is once you've gotten the CT scan, you can feed all that data into a computer, and then you can actually do the surgery ahead of time and make sure everything looks like it's going to be perfect, and then make sure that you match that up in the OR when you're doing the case.
There's an added benefit for the patient.
There are some studies that tend to show that it may ease the recovery and it may decrease some pain because there can be a little bit less soft tissue dissection.
And the length of the surgery depends on the patient. Typically, a hip or knee replacement is done in about 90 minutes. Most patients go home the day of the surgery.